Doctor, retroperitoneal hemorrhage, what is the approach? You have got midline retroperitoneum, perinephric space and pelvic retroperitoneum बोल के निजाम डायनास्टी के दिनों में हैदराबाद को डिवाइड किया। ये हुसैन सागर की रास्ता है, ये एबिट्स होता है और ये गच्चिबौली होता है, पेरिफेरी आउटर रिंग रोड। क्या ये आउटसाइड पेरिरिनल है ना, दिस एरिया, द ब्लू एरिया। आउट ऑफ ऑल दिस ओनली दिस सेंट्रल जोन में अगर इंजरी है तो ब्लंट और सेकेंड टाइप क्या है, पेनिट्रेटिंग, यू हैव टू एक्सप्लोर। बट if there is any injury that is happening in the zone 3, what is the rule? Zone 1 में for both penetrating and also blunt injury you need to do exploratory laparotomy. But of the remaining zones, whatever that are there, unless it is penetrating, you need not do surgical exploration. That is the rule. That point को पकड़ के examiner ने straight away क्वेश्चन बनाया है इसको। फर्स्ट क्राइबल क्वेश्चन, टॉर्चर क्वेश्चन, देन सेकेंड टॉर्चर क्वेश्चन। एमबीबीएस लेवल का नहीं है, यू गो टू कोर्ट एंड आस्क। प्रॉस्पेक्टस में दिया एमबीबीएस लेवल का, इसलिए ये क्वेश्चन इज नॉट फॉलोइंग इनटू एमबीबीएस लेवल। आई डोंट वांट दिस क्वेश्चन। देन ओके, I leave the literature for you. We will post all this in the newsformedico.com. All this explanation. So then doctor, fever, sore throat, conjunctivitis, skin rash, transbronchial biopsy, histopathology has been shown, and you are supposed to identify Warthin-Finkelday giant cells. Tough doctor. सीबीपी में आरबीसी का है मालूम नहीं है, इतना मासूम बच्चे हैं हम, हमको ले जाके वार्थिन फिंकल्टी सेल को पहचानो बोले तो कहा होता है डॉक्टर? कैन यू आइडेंटिफाई न्यूट्रोफिल, हिस्टोफिल, आरबीसी, लिम्फोसाइट? आई अंडरस्टूड इट ओनली इन सेकेंड ईयर एमडी। सेकेंड ईयर एमडी मीन्स एमडी जनरल मेडिसिन में फर्स्ट ईयर थर्ड ईयर और बिजी टाइम, सेकेंड ईयर इज लाइक ए हॉलीडे, पेरिफेरल पोस्टिंग्स होता है, तो टाइम पास। जाके वो माइक्रोस्कोप में एक दिन देख रहे तो आवर पैथोलॉजी एमडी वाज सेइंग, डू यू नो हाउ टू रिकॉग्नाइज लिम्फोसाइट बोल के। तो फर्स्ट टाइम आई लर्न इन एमडी सेकेंड ईयर इन जनरल मेडिसिन में, वार्थिन फिंकल्डी अगर कोई रिकॉग्नाइज करे तो ही इज बॉर्न टू टेक एमडी पैथोलॉजी, राइट? कंज्यूमर एक्ट पे how much compensation will be claimed by National Commission? आजकल का रूल क्या है, अगर कोई मर गए तो उनका पूरा जिंदगी का अर्निंग, some rule was there, no doctor, you have to compensate. Maybe if a rich man died, if 10 crores he is supposed to earn in his lifetime, where will you compensate? Impossible. So this also difficult, impossible question. Then which is the ketolite? Macrolide मालूम है, ketolite क्या है बीच में? चुम्मा चिढ़ाने के लिए examiner is ragging us. Erythromycin. By elimination we can do. How will you do, sir? अच्छा, erythrobino, erythrobino, clarithrobino. By elimination you are, I mean, if you, मैं क्या बोल रहा हूं, ये 33 क्वेश्चंस में एलिमिनेट करके 8 क्वेश्चंस हर एक को करेक्ट होता, राइट? अच्छा, एलिमिनेट करके लगा सकते हैं आप। अच्छा, I once remember our SPM professor asking, मुरली ये जेंटामाइसिन क्या होता है और एरिथ्रोमाइसिन क्या होता है और वैंकोमाइसिन क्या होता है, सब एक ही होता है? नहीं सर, वैंकोमाइसिन सेल वॉल के ऊपर काम करता, जेंटामाइसिन न्यूक्लियस के ऊपर काम करता बोल के आई जस्ट वंस मोर अपडेटेड हिम अबाउट ऑल माइसिन्स आर नॉट सेम माइसिन्स। सो या, बट डिफिकल्ट क्वेश्चन। IUGR में Of course, this is a standard question. How to take, what are the ultrasonographic findings of IUGR? MBBS वाला level है. I accept it. But still, doctor, ponderal index is 10th percentile, more than 10th. What is first of all ponderal index? वो बताओ मुझे. Ponderal index is mass in grams by height in centimeter cube. Typical value is 2 to 2.5. If it is a symmetrical IUGR, ponderal index is normal, and if it is low in asymmetric IUGR. And why it is normal in case of symmetrical IUGR? Because in symmetrical IUGR, both the head, abdomen circumference, length, weight, all of them are below 10%. Symmetrical hai. Since all of them are equally affected to become less than 10 percentile, as a ratio, ponderal index doesn't change in symmetrical IUGR. Too much hai. IUGR में ये too much question है. So if you did this wrong, don't worry. Toppers also won't do it right. I can write it and tell you. पहले ये क्या है identify करो. Pterygium, but everybody knows. But pterygium is called surfer site. वो मालूम है या नहीं? चलो elimination पे accept किया. Graft कर सकते हैं maybe. But it is on the nasal side but not temporal side. आंखों में आंख लगा के ये temporal या nasal बोल के in exam में you have to keep looking here and there. Time is over. चलो get up and get out. That guy will say. So impossible question. Don't cry if you did this wrong. So what is this called? Bindas position. What is this position called? Too much, doctor. So it is Pigilow's method. What is Lakh's method? It is basically for palpation of deep surface of thyroid. Crilly's method for palpation of small nodules in thyroid. MS जनरल सर्जरी फाइनल ईयर में फेल करने के लिए अगर प्लान करे तो एग्जामिनर ये सब पूछते. डिफिकल्ट, इम्पॉसिबल. हाई ग्रेड स्क्वेमस इंट्राएपिथेलियल लीशन में व्हाट इज द ट्रीटमेंट प्रोटोकॉल? Once more, low grade versus high grade, HSIL, LSIL, what is the algorithmic approach? But still I feel that's too much of knowledge in gynecology. I leave the literature for you. Management के लिए क्या करते? What is the approach for HSIL? You will do laser ablation, you will do leads, you will do conization, all of them depending upon different things. So the algorithm of HSIL is definitely a high yield topic, no doubt. But still 10% of outliers among the students only will answer. Exceptional cloud, but not for all. Pseudomonas pyocyanin तब तक मालूम है. Suddenly there is a pyomelanin, pyodigosin, all pyos, too many pyos. Impossible question. Don't try. What is the ratio of the radiation between abdominal CT, chest X-ray? Impossible question. Unless paper is out for you. 500:1. Intrinsic laryngeal membrane. This is little gale mein harash wala question hai. You feel that you know it but you are unable to answer it. That's called as learned helplessness in depression. ये है वो है सब एक ही दिख रहा है. Which is the answer you are not sure kind of a question. Cricovocal comes under intrinsic laryngeal membrane. Laryngeal ligaments and membranes are divided into intrinsic and extrinsic. Intrinsic होता है uniting the cartilage of the larynx to one another. Extrinsic is uniting the cartilage of the larynx to the skeletal structures outside the larynx. So thyroepiglottic membrane, elastic membrane of larynx are the intrinsic laryngeal ligaments, and in the elastic membrane of the larynx typically you have the upper half, which is basically called the quadrangular membrane, like that where is the crico vocalis? Yesterday I was trying to search what is the meaning of crico vocalis to teach you. So, impossible question. You answered wrong means don't worry. This is too much. I think people might have got little hives and the upper lip was swelling slowly watching this question. Anaphylactic response will occur. Too much question. पहला ये answers क्या है मालूम नहीं पड़ेगा. So I asked, how was the paper? Sir, suddenly we were not understanding, is it MD entrance or some other MSc biochemistry entrance or which entrance का question है? बोल के some questions we didn't understand only, sir. Then I thought, 90 images है sir. Then I thought there will be a masala discussion going to happen on Monday. Doctor, indiols are powerful reducing agents. They can reduce cupric to cuprous form, and that is the basis of Benedict's test, which we never did in our biochemistry days. Then heat and acetic acid. Place 5 to 10 ml of clear urine. Boil the upper portion on the flame. If turbidity develops, put to glacial acetic acid. Sometimes turbidity may be due to phosphate or carbonate, and glacial acetic acid will clear the turbidity. And if it is due to protein, then there will be a precipitation. बोल के एक लंबा डिस्क्रिप्शन से एक सेंटेंस को निकाल के MCQ डाल दिया. Difficult. Oh, doctor. You know, ureterocele, what you call cystocele, enterocele, vault descent, ये सब मालूम है. Suddenly level 1 में क्या है, level 2 में क्या है, level 3 में क्या है, lift वाला क्वेश्चन पूछे तो very difficult. Okay, level 1 में. Level 1 is uterosacral cardinal ligament supports the uterus and vaginal wall. Level 2 is pelvic fascia and etc. etc. Then level 3 is liberator muscle. So you just review the literature, what are these levels? Accordingly, level 1 में descent of vault and enterocele are involved. Level 2 में cystocele, rectocele are involved. And level 3 में urethrocele is the one which is involved. That's how the levels are there. A urogynecology, MCS urology वाला question है. Not for MBBS level. Primary gastric lymphoma versus gastric carcinoma, what are the differences? Little higher level question. So, B cell origin is lymphoma. Amenable to treatment is lymphoma than adenocarcinoma which requires surgery. H. pylori is implicated in maltoma. Elimination पे निकाल सकते option D को. Human milk, formula milk, Jersey milk, Asha milk. So you must know, already you went to exam difference between cow milk and human milk, and buffalo milk and goat milk. So examiner suddenly सबको छोड़ के सिंपल क्वेश्चन पूछता, क्या है मिल्क के अंदर? Transforming growth factor. If you are lucky to answer this, you will answer. That's all. No big deal. Typically, if you look at Cruzen is craniosynostosis. So in craniosynostosis, fontanelle becomes small, not large. Another impossible question. Revised cardiac index. एक index होता ना entrance में, which we cannot answer. This is that index वाला question. You take Maharashtra, Bihar, Uttar Pradesh, any entrance exam, state entrance, एक index वाला question पूछता. So actually, intrathoracic, interperitoneal, infrainguinal vascular surgery are the independent predictors. Similarly, ischemic heart disease, congestive heart failure, S3 gallop is there, no, there is congestive heart failure. Serum creatinine more than 2. ये सब predictors के basis पे anesthetic preoperative fitness को decide करते. That is basically called cardiac risk index in pre-op evaluation. Very difficult. Unless you have done diploma anesthesia and once more writing MD entrance, you can't answer this. Doctor, this is the wastage of human life. सिप में डिफरेंट सिप्स है, आपके हाथ में नहीं है. सिंपल P450 inducers inhibitors that you can read, but SIP 1A1 what are the drugs, 1A2 what are the drugs, 2A6 what are the drugs, who will remember doctor? Unless your brain will have colic-refractive necrosis. उसमें suddenly one of the SIP types is 2D6. क्या है 2D6 में acetaminophen, codeine, what is this? Debnis, whatever. हाँ, तो they are included. Impossible. If you remember, this table means it is like expecting you to tell the 64th table multiplication in LKG. Second table you can tell, not 64th table. Na? Doctor. Erythroplakia is pre-malignant. But out of this, किस मुंह में के अंदर erythroplakia, which is candidiasis, which is lichen planus, you have to recognize it pictorially is the challenge. Eosinophils are recruited by which chemokines? We only prepare for interleukins at most. Chemokines में भी varieties है. Impossible question. CCR3 is involved in eosinophil chemotaxis. What is this? Spade है, or is it forensic weapon है, SPM का thermometer है, what is this instrument? This is basically called, Wikipedia में image होता है, straight जाके Wikipedia मारो, sling psychrometer बोलते हैं इसको. Too much doctor. सीजर्स का टाइप क्या है बोल पूछते, और स्लिंग साइक्रोमीटर और सेप्टिक लैट्रिन में वेराइटीज भी नेक्स्ट एंट्रेंस में आएगा. सो ऑल दोस थिंग्स यू मस्ट बी रेडी. तो दैट इज स्लिंग साइक्रोमीटर इज यूज्ड फॉर व्हाट? मेजरिंग द रिलेटिव ह्यूमिडिटी ऑफ एयर. इम्पॉसिबल. 33 क्वेश्चंस में मैं ये 33 क्वेश्चंस में नॉट मोर देन 7-8 क्वेश्चंस विल बी डन करेक्टली बाय दैट, even by the topper. These are equal for both topper, anybody in the entrance, open for testing your luck. Anti-lymphocyte serum is a heterologous anti-serum, not a homologous anti-serum. On that statement, opposite antonyms are made, and remaining are only मजाक कर रहे examiner आपसे. So very difficult. वन रिकेट्सियल देगा, मगर सुसुकुमुशी are found in the salivary gland of chigger. Infected chigger inoculate the organism into the skin. This is the rickettsia caused by O. Sisugumushi. What is that typhus called? Scrubber. So rickets में earlier they used to torture by asking OX19 कहाँ है, OKT3 कहाँ है, and all that. Now this is a new way. Impossible to answer. Quinsy, which part of the tonsil is affected? Is it any old question? I don't know. Cryptomagna, then you have primary crypts and secondary crypts. Cryptomagna is the first crypt to get affected in the palatine tonsil, in peritonsillar abscess. Quinsy is a standard topic, but I don't remember cryptomagna being the first is a previous MCQ or not, I don't know. How many answered correctly? Are Bob, very good. Nice bullseye. Once more. Forceps, different instruments. So you must be quite sure, doctor, on which is a hermitage forceps, which is a outlet forceps, which is a ovum forceps, etc. out of this. So इसलिए इंस्ट्रूमेंट्स के लिए दास के पीछे वाले इमेजेस एंड दत्ता एंड शॉ में भी लास्ट में यू विल हैव सम इमेजेस, वो देख के जाना है. Luckily you will get one which is not a second generation endometrial ablation. Too much. First generation only we are not sure. So first generation means histoscopic laser, transcervical dissection, roller ball endometrial ablation. Recently in one of the AIMS question bank question we discussed this. Second generation में आता है microwave, cryotherapy, hydrothermal, fluid balloon. Still very difficult question. Which is lateral, which is medial among these pathways? पहला ये pathways पहली बार कोई सुन रहे हैं क्या? What are extrapyramidal pathways? Rubrospinal, tectospinal, reticulospinal. So out of this, which is not considered to be a medial pathway? Very difficult. Which is medial, which is lateral among this ascending pathways is too much in anatomy. I am assuming the answer is correct. I didn't do a background check of the rubrospinal because impossible question है. Impossible question का answer wrong दिए तो better है. क्योंकि but answer is given correctly. अच्छा, you thought vestibulospinal not as a medial. Why? I know. Vestibulospinal means ears. Ears are lateral. So that is the reason pathway should be lateral. I know, doctor. I know. What is your छोटा दिमाग क्या सोच रहे हैं? What is true about radiation therapy? Yeah. Grange and Bucky ray therapy. What is Grange rays? Grange rays are a form of radiation which is similar to ultraviolet radiation, X-rays or gamma rays. The only thing is Grange rays are low kilovoltage and they have got a very low penetration power. There are certain set of conditions dermatological which are where the Grange rays are used. But too much question in dermatology. Yeah, 33 questions, such impossible questions, definitely mood will be off. Mood will be off. But still 110 which you answered correctly should be there. That should help you to not cry and leave the exam hall even without finishing. Yeah. Generally exam में 130-140 questions smooth देते थे. Like 110 came, 130-140 generally होता. 50-60 में भी थोड़ा torture होता. मगर यहाँ तो 33 impossible दे दिया और 55 you are waving here and there, 110 expecting that you will answer correctly. So when will legs come, when will external genitalia will come, when will embryo get a human shape? They are all two fine aspects on the timing of the embryology. Another impossible question. Oh doctor, ये तो DM cardiology entrance का question है. RA pressure, RB pressure, PA pressure has been given and wedge pressure was given. Pulmonary wedge pressure is a reflection of left atrial pressure. So RV and PA being high, it is a classical question of massive pulmonary embolism leading to pulmonary hypertension acutely. All the story has been given to you, doctor. Only thing you must know, liver fail LFT abnormality के साथ hemolytic anemia कहाँ होता? Along with splenomegaly. All of you after going through know that LFT is abnormal. साथ ही साथ क्या है? Splenomegaly भी दिखाई दे रहे. Splenomegaly है क्या? इसी क्वेश्चन में है ना? Nodular enlarged spleen is there. Along with that hemolytic anemia is there because reticulocytosis is 5. Along with anemia. That means hemolysis is there. All that combination is explained only by Wilson. Too challenging question. USMLE step 3. Then doctor, if you don't get a seat, at least learn how to become a policeman. Guns. That too guns में simple guns नहीं. Guns में varieties क्या है? हंटिंग के लिए क्या गन इस्तेमाल करते, दिवाली में क्या इस्तेमाल करते, वो सब. शॉटगन में चोक टाइप्स आर लाइक दिस: cylinder bore, improved cylinder choke, etc. Modified choke. This is called paradox gun. It is a thing used in Holland. Then this is the one which is basically called musket. Three musketeers बोल के मूवी है ना, हाँ? तो musket बोले तो ऐसे रहता, और कार्बाइन बोले तो गन विल बी लाइक दिस. इसलिए खाली पढ़ने से सीखने मिलता, बीच बीच में HD स्टार टीवी भी देखना है. गॉट इट? वर्ल्ड हेल्थ डे सेलिब्रेटेड ऑन 7th April 2015. What was the theme? From farm to plate, make the food safe is the slogan. Right? One controversy, I am not sure Durham and Curran are criminal responsibility of insane or sane. But the answer examiner was given was B. B or C was given? C was only given, no? Huh? So then it is not controversial. Sorry. Already panicked life. Don't panic further. That is the story, doctor. Then finally, I told you now, one question will come on cholestasis of pregnancy, PUP syndrome versus viral hepatitis in pregnancy versus HELLP. How will you recognize one from the other? So, obstetrical cholestasis का features क्या होता है? Bile acids are raised, bilirubin raised, GGT raised, alkaline phosphatase raised. And typically 8th month primigravida is the risk factor for obstetric jaundice, is what you need to remember. Then what are the these two are basically that 110 wala questions actually. Easy to crack, 110 wala questions. Male rheumatic custom Hostner is fallopian Mullerian abnormality. XX is the karyotype, not XY. This also another 110 wala question, easy question. By mistake last में आया classification में. Unilateral tender inguinal adenopathy typical of Shank. So that is the story, doctor. So how is life? Huh? Okay. Topper gets 110 out of 110. Assume that it is a wrong assumption. Let us assume we are topper, at least until results come. 110 में let us assume topper gets कितना स्कोर दे देंगे topper को? 80 है? What is 80% of 110? Give me the board. We'll make some psychologically comfortable scoring. 80% of 110 is 88 out of 110. Let us assume our imaginary topper. Then out of 55 questions, I am thinking 70% will be done correctly by topper. Any other second word? वो 55 वाला क्वेश्चन है ना, 70% टू मच फॉर टॉपर है, और कर सकते. हाँ 60 लगाएंगे, चलो 60 साइकोलॉजिकल सेफ्टी डॉक्टर. 60% ऑफ 55 क्या होता? ऑलरेडी आई सेड 158 इज टॉपर स्कोर, मैक्सिमम 2 प्लस और 2 माइनस. रिजल्ट आने के बाद देखेंगे, बेट करेंगे क्या? एवरी ईयर वॉट एवर आई प्रोडिक्ट विल कम सेम एब्सोल्यूट स्कोर. बट दिस ईयर आई डोंट नो how the student strength is. 55 out of 70% of 55 कितना? Not 70%. कितना बोले आप? 60. 33 है ना? So 33 आ गया है. Then 33 questions impossible to crack में 8. लक सबको 8 से ज्यादा नहीं होता. और do you think लक से भी आंसर करे तो ज्यादा आता क्या? नहीं आएगा, इम्पॉसिबल है. 8. तो अगर आप स्कोर लिए तो 33 8 कितना? 41. 41 8 49. 49 plus 80 129. Actually 129 is our score. Till now in the history of APPG इतना लो स्कोर कभी भी नहीं आया. So that is the reason, don't dream. 130 aa gayi to good hai, but still 158 is my bet, doctor. Let us see after the result come. So, but anyway, whatever be the result, it's all game, doctor. 2 decades I had been seeing. Huh? Somebody in AMC, Andhra Medical College is getting 160. Already see, there will be mutant alleles, doctor, everywhere. So somebody from the Andhra Medical College is having 161. So 158 is achievable, scientifically acceptable score hai. But why I am emphasizing that point of 158 is, next time when you go for DNB or AIMS or any entrance, that 110 100% correct kar rahe, to aap remaining thing drama, automatically you will do correct, and you will automatically get kitna 160 aa jata, but that 110 you should crack. That should be your goal, which is achievable by reading just kitna topics out of 600 topics, 200 topics, which take hardly 100 hours preparation. More than 100 hours, you don't need time to be wasted. Beautiful life this is. Okay, doctor. So if you did wrong, if you did more mistakes, don't dishearten. I have seen people who could get only 90 marks on 1 year, and within another 6 months they got a very good rank in JIPMER and AIMS, and 90 marks in the last entrance, they made it 145, 150 in the next APPG. Everything is possible provided you are ready for the transformation, right? Good luck. Thank you.